Hello, welcome everybody to another great episode of Discover Your Ideal Body with Christine. I'm going to begin this episode with a quick anecdote. A few months ago, some of you may have been following me. I had an Instagram story where I was wearing a CGM, continuous glucose monitor. We were looking and tracking those numbers. In the meantime, I had scheduled an appointment with a hormone specialist. We found, for me in particular, that the sugars were spiking in certain areas. I'd been having a hard time losing weight the past few years. And I just wanted to see what that was looking like in terms of my sugar levels. I took that information and I went and saw a specialist. Her name is Dr. Marie Dam, who I'm honored to say is my guest today. I learned so much about what was going on with my body, and it was started out with my hormones. After a very elaborate, full hormone panel that was done, we're talking several vials of blood taken and a saliva test for cortisol over the period of 4 times throughout the day, not just one blood test, which I had a few years ago and gave me a lot of misinformation, unfortunately. I was able to tell that there were a lot of my hormone levels that were dramatically off key, and that would be an understatement. And that had affected my blood sugar levels, my energy level, my ability to lose weight. Um, and basically, it really affects, as Marie says, female hormones are a symphony. So if that symphony isn't working properly, it's really going to affect you dramatically. Um, I have been on her regimen for now we're into April, so 4 months. And I kind of wanted to give it some time before I spoke about it and had her on. I can tell you that it is night and day. My energy level, my ability to lose weight, the foods I choose, even though I ate healthy and I knew how to eat, as I was trained by integrative nutrition. It once you hit 40 for women, some foods are off the charts, off the table. They're just not an option. We just cannot metabolize them the way we used to. And it was interesting coming from her perspective, because this is what she deals with all the time. Preventative medicine, integrative medicine. She is an MD, but also a functional medicine doctor. So I really appreciated her perspective. That's just a little brief summary of what occurred the past few months. We're going to dive deep into women's hormones when Dr. Dam comes on, but I just wanted to give a little preface to that and just say that, do your homework, be your advocate. I'm grateful I did, and I'm grateful Dr. Dam is going to be on now. So enjoy our interview, and hopefully you can learn something for yourself and, be your own advocate and be able to explore your options of health. All right, take care and stay tuned. We're going to have Dr. Dam on very shortly. Welcome, everybody. I have a wonderful guest, Dr. Marie Dam. As I mentioned before during my intro, I want to read a little bit about Dr. Dam. I'm going to read her bio before we start talking to her. So, Dr. Dam, her professional journey has taken her from the beginnings as a traditional trained primary care physician into the world of more holistic care. Dr. Dam graduated from the University of South Florida College of Medicine, completed her residency in internal medicine at Mary Imogene Bassett Hospital in Cooperstown, New York, which is an affiliate of Columbia University. She was board certified in internal medicine and began practicing internal medicine and emergency medicine for a decade before her own health issues necessitated a change in her life. When she could find no traditional answers in her own symptoms, and she decided to expand her knowledge base into functional medicine and hormone therapies. She completed a fellowship at the American Academy of Anti-Aging and Regenerative Medicine in 2010 and has now embraced a more holistic approach to medicine, one which optimizes health rather than chases the symptoms of disease. She has a background in other energy medicine modalities as well, including kinesiology and NAET. Her quest has taken her through many fields of medicine, including laser surgery, occupational medicine, and addiction medicine. In her practice in Connecticut, she helps both men and women feel young and vibrant with bioidentical and other hormone therapies, peptides, detox therapies, weight management, and optimum nutrition. Welcome, Dr. Dam. I am
Thank
so
you.
excited to have you today.
Thank
Uh,
you.
so I'm just gonna do a little preview. I mentioned just before that, you know, it had taken me a while to get to Dr. Dam. I had done my own, I'll call it traditional routes, so to speak, of going to the doctor, telling them my symptoms, getting simple blood tests. At one point, I can actually recall I was telling the nurse practitioner what tests she probably should do on me. That doesn't sound right, right? Right, it isn't. And I'm not a doctor, so there you go. And suffered really for the 3 years since that because I took those answers as well, that must be the way it is, instead of really being my own advocate. Finally, after a friend of mine who is well versed in integrative medicine said, you really need to try to see Dr. Dam, and I researched her. I got to her and I got the appointment. And boy, oh boy, did we find out some startling little facts and figures about my body. I'm just going to share one because this is the most profound. And I don't know if you recall this, but I'll never forget. It was a surprise to me about my cortisol level was so low. And Dr. Dam sort of leaned in a little and she goes, Christine, your body basically thinks you're dead. And was I was like, "Oh my god." I just almost like cried, but I was like, "Well, holy crap. Well, that explain." And she explained to me what that did. That explained, to myself, I said, "Okay, that now that the dots are all connecting. Now I know why I've been feeling this way." Amongst other things, besides just the hormones, was some of the nutrients that I was missing. Simple things, and I knew better, but like simple things like magnesium, I wasn't taking them a night until she said, "Oh yeah, high blood pressure, you're probably low in magnesium." Well, she was right, and sure enough, when I started to take my supplements, my girlfriend's a nurse. She was taking my blood pressure. Everything smoothed out. So that's a brief snippet of just my situation. I love what you said to me about women's hormones being a symphony. And on that note, I want to toss it over to you because Dr. Dam, I want to know how you got into this field. What brought you here?
Well, it's interesting because I had worked in many different fields of medicine, and I moved to Connecticut, and I had a laser surgery center, and I had two children, and I still worked in the emergency room. And I reached a point in my life where I I had irritable bowel.
Mm.
And I reached a point in my life where I basically collapsed in the emergency room with the irritable bowel. And these were episodes I had all the time. And but I didn't really have a blood pressure, and they tried to resuscitate me. And I was like, geez, I do this all the time. So I quit working traditional medicine and really was feeling horrible for about 7 years. I was able to work one shift a week, and I was exhausted. I knew I was dying, and I didn't know what I was dying from.
Oh my gosh.
And it was, I worked in a chiropractic office, and they had this technique called NAET.
Mhm.
And I couldn't figure out what it was. It was an energy thing. But I would sit and talk to the patients in the waiting room,
Mhm.
and they were all like, this is the greatest thing ever. This has brought me back to life, and I used to be allergic to cats, and now I'm not. So I decided to go out to California to
Mhm.
learn this. And they started me on this journey, and they told me my adrenal glands were very, very, very low. And I said, I thought they were, but I went to my endocrinologist and he told me I was fine, even though I knew I
You're
wasn't.
fine.
And I didn't exactly, and I didn't know what to do about it. So I ran into a naturopath, and she gave me an adrenal extract, and within a month or so, I was back. And that is really how my journey began. I
Mm.
also, in my 20s, had panic attacks. Um, so I had all these things that Western medicine really didn't handle. Panic attacks. I probably, in retrospect, had Lyme as
Mm.
well. I've had that several times, and adrenal fatigue. And Western medicine just doesn't even acknowledge that. As a matter of fact, my particular endocrinologist told me something that was shocking to me, and he said, Marie, your adrenals are either 100% perfect or they're 100% broke. There's no in between.
Oh
And
man.
I said, what? In health, in medicine, in biochemistry, in physiology, it's all in between. There's no such thing as 100% or 0%.
Yeah.
So I went back to school and did a fellowship in functional medicine to learn all about these kinds of things, and was
Wow.
very drawn to the bioidentical hormone um, field, because there were so many women that were coming in my practice in their 30s and 40s and saying, I don't know what's wrong with me. I've been to 6 doctors.
Mm.
I they all tell me I'm fine. I don't know if this is physical and there's something really wrong that they're missing, or is this emotional, or am I just crazy?
Hmm.
Like my family says. And I kept thinking, as a woman, if I could figure that piece out, I could help so many people. And that is the bioidentical connection, because that's most of my patients.
Yeah. You
They
know
have
that
tried so many things.
you're right. And a few things I'm just thinking right off the bat. Here you are, traditional medicine, everything's fine. It's not fine. Um, and and it's a little tweak here and there, because I remember you saying to me, because we one of the things that we have, I'm on adrenal support as well, and progesterone, and I've noticed a tremendous change, a tremendous benefit, and observations from people where they'll say, oh, your skin just looks great, and I'm like, oh, I don't know, I think everything's shifting. I don't know, for the good, my energy increased, everything has improved, and it continues to improve. It's a process. And I
It's a
remember you saying, this is a 6 to 9 month thing, shift that we're going to look at. It's going to evolve. We're going to take tests and keep looking at the numbers. But I remember at one point you were standing at the desk and you were looking at my numbers. And it was like looking at a scientist, like you were creating this picture. And I said to you, you're creating a story. Like I could see you looking at my numbers, saying, okay, this is her story based on these numbers. So now that I have this story, I know how to move forward with the rest of the story. And, you know, let's talk about the hormones, because I'm very familiar with A4M from my past history. Company I worked for, an integrated medical
Yes.
device company. So we knew that, this is going back 14, 15 years ago, when most people hadn't, when Suzanne Summers had started, when she used to
Right.
speak at A4M in Vegas, right?
Yes.
And, people would poo-poo her, but she was a smart lady. And I remember many times, and we had done an interview with her also with OnDemand, and she was a really smart lady. And I was like, no, she's really on to something. There's something here. So when people are questioning the hormones, what's your advice on that? Because some people used to say it wasn't good for you or it is good for you. What do you feel?
So, first of all, I'm going to back up just a little bit, and I'm going to say that when you are prescribing bioidentical hormones, you are taking a holistic approach to health.
Mm.
And that is a big fork in the road,
Hmm.
because there are traditional medicine, you wait until you have a disease,
Hmm.
and then you work backwards and you chase the symptoms.
Mm.
And you're
Yes.
not really getting to the core of things. For instance, if you go into your family practice doctor and you say that you're having hot flashes and night sweats, which is clearly low estrogen, they're more than likely to give you an antidepressant.
Mm.
And that is because you will get maybe a 25% improvement on your symptoms, but
Hmm.
you do not have a deficiency of an antidepressant. You
Right.
have a deficiency of a bioidentical hormone,
Right.
right? So, what we do is we try to address we give the body what it needs. The
Hmm.
body knows how to sort through it and it works.
Yeah.
So, you're right. So many people have negative ideas. It's been drilled and drilled into women
Hmm.
that hormones are bad
Hmm.
and that they cause cancer. But we don't see a lot of young women having cancer,
Right.
right? That's when our hormones are the best,
Hmm.
you know.
That's
And
true.
it's
Good
all
point.
about balance. And years ago, even in the 40s, bioidentical hormones were used. And by bioidentical, what I mean is these are the exact chemicals that your body naturally produces. These
Mm.
are not synthetically made
Right.
hormones. They're not horse hormones.
Okay. Yep.
They are naturally occurring, and your body knows exactly what to do with them.
Hmm.
Um, Hormones are a little different than drugs and medications because there are receptors in your body,
Mm.
and
Okay.
it's almost like a three-dimensional jigsaw puzzle. That hormone has to lock into that receptor,
Hmm.
and then you get the effect.
Okay.
All right.
Yes.
And
Yep.
if it's kind of close but it's not it, you don't get that effect. And so years ago, bioidentical hormones were used very successfully by doctors. But then the drug companies came out and they could not make money on naturally occurring
Oh.
bioidentical hormones. So they started, instead of progesterone, they developed progestins. Now, those sound the same, but those are completely different substances, even though many OBGYNs will use them interchangeably with people.
Oh. Hmm. Interesting.
The progesterones are very protective for cancers, for breast cancer, for uterine cancer, for ovarian cancer, because they keep you from being estrogen dominant and they're part of the balance.
Right.
They also keep your heart very, very healthy
Hmm.
along with your estrogen,
Yep.
right? That's why women have such an advantage cardiovascularly over men
Hmm.
until we lose our hormones,
Ah, yes.
right? And then
Yep.
we very quickly catch up to the men's um, statistics in
Yeah.
heart attacks and strokes if we don't replace them.
Ah.
Um, so, um, so many people and many studies and many GYNs, they don't understand the difference between bioidentical hormones and synthetic hormones. And clearly, with synthetic hormones, like a birth control pill,
Hmm.
like Prempro, we know that clearly there's no question that they cause cancer.
Mm.
And in fact, there were no studies done on birth control pills for about 50 years because they knew that if they really investigated them, they'd have to pull them. And from a society standpoint, that they did not want that to happen.
Oh,
So they
wow.
so they don't look, don't tell.
Wow. That is something. And when you're talking about bioidentical hormones, is both men and women, do they they both get treated with bioidentical? I'm assuming different ones.
Both men and women. That's
Mhm.
true.
Okay.
Although women, as we know, are much more complicated creatures.
Yay.
Men are much simpler. Sometimes for men, we can use bioidentical testosterone pellets and bioidentical testosterone cream or gels. But if we use injectable testosterone, it is not exactly bioidentical.
Oh,
And
okay.
but it's pretty close. It's
Hmm.
pretty close. And still, testosterone for men is their life force.
Okay.
But women need multiple hormones. They need estrogen in balance with progesterone.
Hmm.
They need testosterone.
Hmm.
Just, we all, and they need DHEA. So we
Yes.
need them all, but a different balance than, say, men would.
It really is a symphony. Gosh. It's like,
Yes.
yeah, it's really, it's
Yes,
like
and
the,
it's not just a matter of just um, pushing one over the other.
Mm-hmm.
For instance, in traditional medicine, when you have a hysterectomy, they never give you progestins or progesterone after that. They give you just pure estrogen. And then they say, wow, the statistics of that don't look so good, even though now they've kind of backed off on that if they give you bioidentical estrogen. But you still need, whether you have a uterus or not, you still need progesterone.
Yeah.
That's what protects your whole cardiovascular system, that it's a natural antidepressant, it's a natural diuretic, it protects you against breast cancer, it makes your brain work better, does all these things. It helps you sleep, it moderates your moods, protects you against migraines,
Wow.
all kinds of things. And of course, just because you had a hysterectomy doesn't mean you don't need that.
Gosh, this is so amazing. I just feel so bad for all of the women who have gone through this and not had this valuable information. It's simple, but it's valuable. It's so important. Oh my God. Excuse me. It makes me think of a couple of women I know who have had hysterectomies. There's no way that they've been taking any kind of bioidentical support in their lives at all. So then I'm thinking, oh my gosh, this is really going to affect their cardiovascular health, later on in years, or and we were
Yes.
talking about
And
treatment. Go ahead.
and their lives immediately.
Immediately.
And their
Oh,
lives immediately, because so many times they're they're immediately castrated, right? We do this to
yes.
women. We basically castrate them with hysterectomies. And the one thing I will say is that low progesterone
Mm-hmm.
is essentially the reason that many women require, in traditional terms, a hysterectomy. They either get fibroids,
Mm-hmm.
they have uncomfortable bleeding. All of those things are because their progesterone has been low. And once progesterone can be low from teenage years,
Wow.
and part of the reason that progesterones are low is because it's the precursor to cortisol, which is your stress hormone. So you can be very stressed when you're in college.
Sure.
You can be very stressed all through your lives. And when your progesterone is low, you are going to have very heavy periods. You're going to have fibrocystic breasts. You could have ovarian cysts. You can have menstrual migraines. You can have severe PMS.
Mm-hmm.
And progesterone is also your bone building hormone. So your bones can start weakening. And then you get fibroids. And then you go to your doctor and they say, you have a bad uterus. That thing needs to come out. And then they take that out and you don't really feel better because the issue hasn't been corrected. And then they say, you know what, you don't have a uterus, so I can't treat you anymore.
Oh.
So, or they give you estrogen because now they've taken your ovaries, and what you really needed was progesterone all along.
Oh
And
my gosh.
so we see that over and over and over and over and over. And it's really a shame. It's really a shame
It really is a shame.
because it's not difficult. It is so not difficult.
No. And
But
I have a friend who we were both kind of searching at the same time, but she's a little bit older than I am. Uh, we were both aware of bioidentical hormones, but her ex-husband now his ex-husband, but at the time her husband kept saying, "Oh, I've heard so many bad things about it." We talked about that, but now she's finally started on bioidentical hormones later in life, like mid 60s. And
mhm.
so, you and I sort of talked about waiting versus addressing it sooner than later. So you just speak to that a little bit if somebody's
So
considering it.
most women are perimenopausal for 10 or 15 years
Hmm.
prior to them stopping their periods, which is the definition of menopause.
Okay.
But just because you're having a period doesn't mean your hormones are in great balance. And you're with a low progesterone, you can be losing lots of bone mass. You can be uh, experiencing lots of different symptoms
Hmm.
that you don't need to. So what I say about the timing is, first of all, everyone is different,
Mhm.
completely different. Everyone's an individual, and every program should be customized
Mhm.
for that individual. But the sooner you start to have optimum hormones, the less you will lose.
Mhm.
Okay. So
Yeah.
if you wait until you're 65 and you've been menopausal for 15 or 20 years,
Mhm.
the losses that you've sustained uh, are there. You can continue to maintain that, but it's difficult to get that back.
Gotcha.
Difficult to get that back.
Right.
Um, so you now just so what nature does, nature keeps us optimal, right
Mhm.
up until childbearing years.
Mhm.
Nature's like, I got you. You have, reserves of nutrients, and you have
Mhm.
reserves of hormones, and you have,
Yeah.
okay. And then you hit 35 or so, and then nature's like, well, I'm not going to keep you optimum because you've had your babies. So,
Hmm.
so just because our hormone levels drop at that time and continue to drop throughout our lives doesn't mean we don't need them.
Right.
It doesn't mean that we want that slow slide into the nursing home.
Yeah.
And one of the things that hormones in a nutshell do
Mhm.
is when we're young, we are healing and we are rebuilding our bodies
Mhm.
faster than we are deteriorating, right?
Mm.
That's the definition of youth.
Yes.
We're growing, we're getting better and better. And
Yeah.
as we get older, we deteriorate a little faster than we can build back. And that's true for our bones, it's true for our muscles, it's true for our skin, our eyes, our brain, our heart, our lungs,
Yes.
everything. And that's one of the great benefits of balanced hormones is
Mm.
that your tissues, all of your tissues, not just the ones that show,
Yeah.
right? Your brain, all of those things continue to be on the more on the healing path and the regenerative path
Yeah.
than the deteriorating path.
Yeah.
A lot of people ask me, well, what will happen if I don't do hormones?
Mhm.
Right?
Yep.
What will happen? I always say, well, go to a nursing home
Mm.
and look at the people there and really look at them, and you'll
Yeah.
see their skin is thin, they're too their muscle mass is so small that they can't even stand up. Their
Mhm.
bones are not strong, they're not fierce, they're
Yeah.
frail, right?
Yeah.
And it's
That's it.
not just, I don't want to imply that it's just hormones, because in no way is it. It's nutrients, it's exercise,
Yes.
it's mindfulness,
Mhm.
right?
Yep.
It's detoxifying.
Yes. Yep.
It's so many different pieces of that puzzle,
Yeah.
but that's one of the pieces.
Well, and that's true. And going back to what I said in the beginning, when you were looking at my numbers, uh, and this isn't about hormones, this is more about gut health. How important gut health was to my condition, to everybody's condition, by the way. But we know now the importance of gut health is like it's right there. It's at the top, right? And
Absolutely.
it was so interesting because to find out that the foods that I was consuming in like my 30s and early 40s of like, sugar-free stuff and this and just like, thinking I'm doing the right thing. Oh my God, I was destroying my gut health. That was another piece of that puzzle of like, yep, well, this is causing this. Oh, I was like,
Absolutely.
what a
And
learning
then
curve.
the adrenal health is so
Adrenal health.
key.
Oh, yeah,
So
yeah.
key. I
Yes.
mean, I am telling you, I was very low functioning.
Mm.
I waited all day at home, it was hard for me to get dressed. It was hard for me to do anything. And then I would pick my kids up at school because
Mhm.
that was my priority, and do some after school activities with their horses. And then I was done.
Mhm.
And um, that was my life force. I
Yeah.
had none. If you had come in and said, "Here's $20,000, let's go shopping," I would have said, "No, I'm good." No joy, no
Yeah.
vitality, right? So
Yeah.
that's such a huge piece too.
Yeah, and it's so important. And I we talk about I've talked about on many times, like bringing in meditation, stress relieving components and tools to help with the adrenals, because here is the deal. And I'm wondering if you're seeing this, that you're seeing more of adrenal fatigue occur earlier on, or maybe those people are coming in earlier in age than they used to be. We're all stressed, but I think even stressed more than ever. But I always try to say to the 30-year-olds, you know, you're not a rock star. I know you think you are because you feel like you are, but I guarantee right now you're burning up gears in your body you don't even realize until all of a sudden, you're like riding a bike with one good tire. That's what it's like, right? And you're like,
Right.
how did that happen? I don't know. Go look at your 30s. What were you doing? Or your early, right?
That's right. And it's the most productive people that
Yeah.
get hit the hardest because they're doing, I got it. I don't need any help.
Yep.
I'm a get it done kind of person, right? And I was that way. I was the most productive person I knew.
Yeah.
And
Super women.
then I hit the wall and fell the hardest.
Mm,
And then I would say the problem don't know going on. There's not a lot of literature out about it,
mm,
and they don't know how to get help.
yeah. Right.
So naturopaths are quite good in in helping people with that.
Yeah.
But a traditional doctor, not so much. They really just don't acknowledge that. It's
Yeah.
just not on their menu.
Yeah. And I agree with you. I think what I've also seen is more of like, holistic health, whether it be coaching, whether it be integrative centers that are starting to come up slowly. It's a real slow crawl. Celebrities who are
Yes,
talking about integrative health, who are really putting out good content. Somebody like a Dr. Mark Hyman, of that nature, who's really
yes.
talking about. I think that that's bringing awareness, but your traditional care, medical care, is not. It's again, we have to be our own advocates because forget it, they're not, and not all of them. I don't want to say that because I do believe that a lot of those caregivers probably do think outside the box, but they can't act outside the box because of the system they're in.
That's right.
Yeah.
That's right. And I'll tell you from a provider standpoint, once you see that light,
Mm,
once you've heard that bell ring, you can't unring the bell because the
well
whole
said.
paradigm has to be different.
Yeah.
I couldn't anymore practice traditional medicine now because I just don't believe in it. I don't, I
Yeah.
want to head off diabetes 15 years ahead of time, not
Yeah.
wait till you have it and then start treating you.
Yeah. Oh, I love this. Can we talk about one thing that I remember we that came up? It was like I want to say it had to do with my cholesterol, and you had noticed like one was a little high, the other was a little high, but the bottom number was good, and you were explaining to me why we don't like to use the traditional cholesterol medications now and what that does to the body. It was such a learning curve. The whole appointment, the whole time with you has been a learning curve. But if you wouldn't mind, could you talk about that a little bit? I'm really putting myself out here. This is
So
my medical things.
so everybody thinks that cholesterol is a bad thing, but
Mhm.
it is in the cell membrane of every single cell in your body. It's 60% of your brain.
Wow.
It's a very, very healthy substance. What isn't healthy is when it becomes oxidized,
Mhm.
right?
Right.
It's like when something turns to rust. When iron turns to rust, it's
Mhm.
oxidized.
Yes.
But the steel itself is good, right? And the cholesterol comes in our body to repair underlying damage. It is not the culprit.
Mhm.
If your blood vessels are injured, your body sends cholesterol in there to form a plaque to protect the rest of your body from that.
Mhm.
But cholesterol is the precursor to all of your hormones. So you
Mm.
have to have a cholesterol of better than 150 in order to make hormones. And
Wow.
some of those hormones also have implications for neurotransmitters. So
Mhm.
it's also for things like depression and those kinds of things
Oh, okay.
for other things as well. So I I struggle more with my patients, particularly women patients
Hmm.
that have very low cholesterols.
Oh, okay.
And cholesterol isn't so much determined by your diet, it's really more determined by your liver. But primary care doctors like to follow it and push it down, 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 down,
Hmm.
when really it's inflammation that is the culprit in our bodies. And
Gotcha.
inflammation is caused by sugar.
Oh, yeah.
Sugar, not fat. Fat is the healthy thing, good fats, of
Yep.
course,
Hmm.
but sugar is the culprit for inflammation.
Wow.
So your CRP, your C-reactive protein, is more of an indicator in my mind as to your inflammation level,
Mm.
rather than and thus cardiovascular risk factors, or your homocysteine, than your cholesterol.
Wow.
So I'm not a fan of low cholesterols.
Yeah. And so those medications that a lot of people take, what's this, there seems to be a common side effect that affects the brain when you're talking about that. So,
Yeah.
ooh, right. And if they don't
Yes.
know the whole
So
picture.
the statins as a whole,
Mhm.
are they have a certain anti-inflammatory effect,
Mhm.
and that is somewhat helpful, but they deplete your CoQ10, which is a very key nutrient for your cardiovascular and your brain health,
Mm.
amongst many other things. So so in my opinion, many times the depletion of the CoQ10 is far worse than any benefit that you're going to get from moderating your cholesterol.
Uh-huh.
So actually, when the drug companies came out with statins, they actually patented certain formulas where they were combined with CoQ10, because they
Mhm.
knew that this effect was happening and it wasn't good for people. But they made so much money on their non CoQ10 formulas that they
Mhm.
said, we can just hold those patents and we don't really need to put those out. So
Um,
if anyone in your listening audience is on a statin, please
mhm.
be sure to take at least 100 milligrams of CoQ10 to make up for that, to just be
Good to
kind of
know.
even.
Yeah.
When you take a statin and you say, I'm having bad side effect, my muscles are aching, or my brain is
Mhm.
foggy, that's because your CoQ10 is low to start with, and now it's just
Oh,
gone even farther down.
wow.
So really, possibly you should be taking more than the 100 milligrams, but at least that would kind of offset
Offset.
the
Yeah.
negative effect of that.
Yeah. Jeez. God, so much information. So
So
it's like it is a symphony. It is this huge puzzle. It's so many different components. And you're right, everybody is so different. Um, you know, is there any one overall or a few overall points you'd like to make about, when treating, or recommendations or something that you love to impart to your patients about looking at their health and their hormones? Is there like a few points to pay attention to?
well, a couple of things. One is your diet is the foundation of your health.
Mhm. Yep.
Right. So if you put healthy nutrients, we all have lots of reserves. We can do anything we want when we're 18 or 19 and bounce right back. But by
Mhm.
the time we're 30 or 35, our nutrient reserves are low. And
Mhm.
we really have to pay excellent attention to filling those back up with good macronutrients like proteins
Mhm.
and fats and good carbohydrates,
Mhm.
and micronutrients
Mhm.
like the antioxidants and all the colors of all the vegetables,
Yep.
etc.
Yeah.
So I happen to feel that there are people that can eat grain, but
Mhm.
grain in general is GMO
Yeah.
product. It's
Mm.
sprayed with Roundup
Yep.
often, and I think that it is the beginning of the inflammatory response for many, many, many folks.
Yeah.
And so to me, everyone should at least try to go grain free and see if their body doesn't respond. Well, it should respond very quickly within a week or so,
Hmm.
and you will feel less inflammation and you will feel more vitality from that.
Yeah.
And if you don't, then you're one of those people that can eat grain.
Yeah. Remember
And
what
and
you
I'm
told
talking,
me? Women over 40 should never eat. There was like two things.
well, the weight thing is a whole other issue, right? So, starches is a starch is sugar.
Yeah.
Sugar is sugar, desserts are sugar, but so is pasta.
Pasta
So
and
is
bread.
bread. So
Yeah.
it's you might as well look at your plate and see a heap of white sugar because that's what's there when there's a white potato or a bowl of pasta.
Hmm.
So, yes. So those things for some people are okay to do,
Hmm.
provided you're getting wonderful nutrition. If you're having your salad,
Hmm.
your 7 or 8 vegetables a day, couple fruits, if you're getting all of that, you can have your ice cream cone.
Yeah.
Right? But don't have your french fries and your hamburger as your meal because you haven't gotten any nutrition,
Right. It,
right? So
yeah.
so sometimes when I do dietary histories, people are very apologetic. They're like, "Oh, and sometimes I eat this and sometimes I eat that." And I'm trying to tell them, it's not what you're eating that concerns me, it's what you're not eating,
Good point.
right?
Yeah. Yep.
You know, if you get nutrition, then your body can handle a few little incidentals
Yeah.
here and there.
Yep. It's that idea of sort of filling in what you need first, and you just naturally scoot out the bad food because there's no room for it in the day, because you're eating so well.
Right, right.
It's a little
But your
mind
body can
game.
handle eating.
Yeah.
Yeah, your body can handle eating some bad food as long as your body's working perfectly. And
Yeah.
that's the other message I would like to tell people is that you can feel better and better. You can have optimum health. We're not
Mm.
talking about not having disease,
Mhm.
not being neutral, but feeling the best you can feel.
Yeah.
And I feel better at my later age than I did in my 30s.
Yeah.
And you can just, it's not a matter that I have to feel worse and worse and worse because I'm older. It does not have to
Doesn't have
be
to be
that
that way.
way.
Right. Oh God, I love that. It gives people hope. It also helps people to wake up a little to the fact that there's light at this tunnel. Like, if they've been feeling crappy, that they can look to someone to help them and guide them. Um, so a few things. There's one thing I wanted to just pop in here. It's not something we're going to discuss now, but could be an opportunity for another interview. You are working on some stem cell therapy, correct? So
Yes.
that's you don't have to tell us really anything other than to say yes. So that could be an opportunity for another interview. Again, this is all preventative health, integrative health. This is treating the body before it gets sick, keeping the body at its optimum, right?
Right. That is it in a nutshell. That is it in a nutshell. And there are very fascinating regenerative treatments that are available. We're learning how to use them.
Hmm.
They literally um, seem to address many, many issues like brain health
Mm.
and vitality and so many unexpected applications. So
I
I'll
like
leave it at
that.
that. I'll
Yeah.
leave it at that. But it is uh, just an overwhelmingly promising therapies.
All right. Excellent. I love that you're doing this. You're so passionate about this. Everything is so fluid for you because you can see your passion. Um, and you are located in Connecticut. Can you tell people where you're located?
I'm located in Avon, Connecticut, which is a little bit outside of Hartford.
Right. Okay.
Um, and I actually do a fair amount of consults on people from distant areas
Hmm.
in via a telemedicine thing, although I really do like to see my patients initially in person.
Yeah.
So yes, I'm located there.
And just so you guys know, folks, I drove an hour and a half to Dr. Dam because I like to be in people's space and energy. So that first consult we did in person, and it was excellent. Second one, we did a Zoom call because it was winter. But my next appointment, I'm going to take the drive. It's a beautiful drive out there. It's a lovely office, and her and her nurse they're both wonderful. It's well worth it. So I think it's something, of course, I'm plugging you because I use you,
Thank
but,
you.
functional medicine is where it's at. I feel if you're stuck and traditional medicine isn't giving your answers, I mean, Dr. Dam had that experience herself and she was, a physician in primary care medicine. So don't feel so bad. Uh, it's not you, it's information. And we're all about being educated and learning and evolving. So, it's all a process, and if this helps you wake you up, uh, so be it. Any last words from you, Dr. Dam, today?
I just want to thank you so much for having me today. This was so much fun.
It was
And
fun.
I know that it is very difficult for everyone. It was difficult for me as a physician to find help and to maneuver and um, to find, when traditional medicine didn't
Yep.
have the answers for me, like, oh no, what now? So I do appreciate the position that so many people are in to try to find help. So I just want to say, keep looking, keep looking. There's so many things out there, even if they're not in the traditional world.
Yeah, that's great. Thank you so
So
much.
thank you.
Thank you, everybody. Please like and subscribe and share this information with your friends and family. Anybody that you know who may be struggling. There's a lot of just chock full of information in here. And I promise you, it really is only the tip of the iceberg. And, I've been sharing my story. I'll continue to share it. But, I'm proof in the pudding that, there's a lot of hope at the end of this little tunnel. And it's not the end, by the way. And it's not a tunnel. It's lovely. Thank you, everybody. Stay well, enjoy, and I will see you next time. Thank you. Take care.